How does bone cancer metastasis affect prognosis? When we talk about bone cancer metastasis, we're discussing how cancer cells spread from the original tumor in the bone to other parts of the body. This spread can significantly worsen the prognosis compared to cases where the cancer is still confined to the bone. In fact, the presence of metastasis is considered the most crucial prognostic factor for bone cancer. It typically indicates a more advanced stage of the disease and a lower chance of long-term survival. Several key factors influence the prognosis when bone cancer metastasizes. First, the location of the metastasis plays a role. If the cancer has spread only to the lungs, the prognosis may be better than if it has spread to multiple organs or sites. This is because lung-only metastasis can sometimes allow for more targeted treatments, which may improve survival chances. Next, the type of primary cancer is important. Different cancers that spread to bone have varying survival outcomes. For instance, bone metastases from prostate and breast cancers often have longer median survival times, sometimes up to 24 months or more. In contrast, metastases from lung cancer or melanoma tend to have shorter survival times, averaging around 6 months after bone involvement. The extent and number of metastases also matter. Generally, more widespread metastatic disease correlates with a poorer prognosis. Additionally, patient-specific factors like age, overall health, and performance status can influence survival and treatment options, although their impact can vary depending on the type of cancer. The response to treatment is another significant factor. How well the metastatic bone cancer responds to therapies such as surgery, chemotherapy, radiation, or newer targeted treatments can greatly affect prognosis. Focusing on osteosarcoma, which is a primary bone cancer, the presence of metastasis at diagnosis or during treatment significantly reduces survival rates. Non-metastatic osteosarcoma has a relatively better prognosis when treated aggressively. However, metastatic osteosarcoma often leads to poorer outcomes, even with multimodal therapy. Overall, metastatic bone cancer is associated with a significantly reduced life expectancy compared to localized bone cancer. Median survival after the diagnosis of bone metastasis varies widely by cancer type, often measured in months to a few years. Early detection and prompt treatment of metastases can improve quality of life and sometimes extend survival. However, metastatic disease remains a major challenge in bone cancer prognosis. It is essential for patients to seek personalized medical advice from oncology specialists. These professionals can integrate all prognostic factors, including the status of metastasis, to develop an appropriate treatment plan and provide the most accurate prognosis.